A very good evening to all of you. Today we are going to do MCQ challenge of the subject of very important subject of pathology. Pathology has a good coverage of 25 to 30 questions in the NEET PG and about 20 to 25 questions in INSET. The knowledge of pathology forms the foundation for the knowledge of medicine and pediatrics NPS. So let's begin with the first question. Michaelis-Guttman bodies. Michaelis-Guttman bodies, you can see in the image very clearly, are seen in A. Xanthogranulomatous pyelonephritis, B. Malakoplakia, C. Nail patella syndrome, D. None. Michaelis-Guttman bodies are seen in A. Xanthogranulomatous pyelonephritis, B. Malakoplakia, C. Nail patella syndrome, D. None. What do you think is the correct answer here? It is Malakoplakia. See, this Malakoplakia is a variant of cystitis. It is related to chronic bacterial infection, mostly by Escherichia coli or occasionally by Proteus species. It is characterized by unusual appearing macrophages and giant phagosomes. It points to defect in phagocytic or degradative function of macrophage. It is a peculiar pattern of vesical inflammatory reaction characterized microscopically by soft yellow, slightly raised mucosal plaques. So the correct answer here is B. Malakoplaki. DIC is seen in what is DIC? DIC is disseminated intravascular coagulation. A. Acute promyelocytic leukemia. B. Acute myelomonocytic leukemia. CML. D. Autoimmune hemolytic anemia. Now, this DIC or disseminated intravascular coagulation is associated with promyelocytic leukemia. That is acute promyelocytic leukemia, AML M3, which constitutes 5 to 10% of all cases of AML. The leukemic cells of these types of anemia are hypergranular. Granules of these leukemic cells, that is promyelocyte, contain thromboplastin-like material, resulting in widespread disseminated intravascular coagulation. Majority of M3 cases demonstrate a reciprocal translocation involving chromosome 15 and 17, that is T15, 17. Now, what are the causes of DIC? There are two basic causes of an episode of DIC. Release of tissue thromboblastin. This release of tissue thromboblastin can occur due to obstetric complications, AML M3, that is promyelocytic leukemia, then intravascular hemolysis of various origins, trauma, head injury, major surgery, malignant tumors, etc. Now coming to endothelial damage, infections, bacterial, viral, rickettsial, fungal, protozoal, shock, heat stroke, snake venom, drugs or antigen antibody complexes. So the correct answer here is acute promyelocytic leukemia. Liquefacting necrosis. You can see from the image A. Heart, B. Brain, C. Lung, D. Spleen. It is an image of brain. So the correct answer here is B. Brain. The ultimate NEET PG breakthrough blueprint. It is a 2-day event covering all the 19 subjects in a holistic manner. Please click the link in the description box to know for more details and join the WhatsApp group. And please stay in the WhatsApp group till you get selected in either NEET PG or INSCT or both. It will be very beneficial for you. Flare in triple response is mediated by A. Axon reflex, B. arteriolar dilatation, C. Histamine release, D. Local hormone. Well, this flare in triple response is mediated by axon reflex. Cystic medial necrosis is seen in A. Marfan syndrome, B. Friedreich ataxia pattern, C. Down's syndrome, the Kawasaki disease. So the cystic medial necrosis or CMN is a disorder of large arteries characterized by an accumulation of a basophilic ground substance in the media with cyst-like lesions. It is known to occur in certain connective tissue diseases such as Marfan syndrome, Ehlers-Danlos syndrome, and annuloaortic ectasia, which usually results from degenerative changes in the aortic valve. The relationship between cystic medial necrosis and congenital heart defect, as well as other disorders, have been evidenced. The mechanism are still controversial, even though many molecular studies have been conducted. It is characterized by elastic tissue fragmentation and separation of elastic and fibromuscular event elements of tunica media by small cleft-like spaces. So the correct answer here is A. Marfan syndrome. Causes of constrictive pericarditis is are A. TB, B. SLA, C. brucellosis, D. A and B. The causes of constrictive pericarditis are idiopathic, infectious, viral TB, fungal, parasitic, post-cardiac surgery, post-radiation therapy, connective tissue disorders, uremia, malignant, drug-induced sarcoidosis. So the most common cause is tuberculosis, pericardial malignancy, especially breast, lung, post-viral pericarditis, especially hemorrhagic. Drugs like hydralazine, procainamide, minoxidil, phenytoin can cause the constrictive pericarditis. Purulent pericarditis, trauma, post-cardiac surgery, hemopericardium, fungal pericarditis, conductive tissue disorders, SLE, rheumatoid arthritis, sarcoidosis, parasitic pericarditis, Dressler syndrome, mediastinal radiotherapy, and renal failure can all cause constrictive pericarditis. So the correct answer here is A and D. D, that is A and B. Both TB and SLE can cause constrictive pericarditis. In cell death, myelin figures are derived from A. nucleus, B. cell membrane, C. cytoplasm, D. mitochondria. These myelin figures are cytoplasmic bodies composed of concentric whorls of membrane derived from damaged cell membrane. Myelin figures appear during reversible injury, but they are more pronounced in irreversible injury. So the correct answer here is B. Cell membrane. Enzyme that protects the brain from free radical injury is A. Myeloperoxidase, B. Superoxide dismutase, C. MAO dehydroxylase. Antioxidant mechanism. Cells have multiple mechanisms to remove free radicals and thereby minimizing injury. Several non-enzymatic and enzymatic systems contribute to inactivation of free radical reaction. The non-enzymatic systems include antioxidants, vitamin E, vitamin A, vitamin C, glutathione, and cysteine, block the initiation of free radical formation and inactivate free radicals. Tissue proteins, transferrin, ferritin, lactoferritin, ceruloplasmin. Iron and copper can catalyze the formation of free radicals. These transport and store the protein decreases the reactive free iron and copper, thereby minimizing the free radical formation. So the correct answer here is B, superoxide dismutase. Fat necrosis is common in, you can see from the image, it is fat necrosis is common in A, omentum, B, breast, C, retroperitoneal fat, and D, all of them. There are two types of fat necrosis. One is the enzymatic fat necrosis. This is due to action of lipase on the adipose tissue. And this occurs most frequently in acute pancreatitis due to leakage of lipase. Depending on severity of acute pancreatitis, fat necrosis can occur in adipose tissue contiguous to pancreas, that is retroperitoneal fat, adipose tissue in anterior mediastinum, bone marrow, omental and abdominal fat. The non-enzymatic or traumatic fat necrosis occurs due to trauma and is seen in subcutaneous tissue of breast, thigh, and abdomen. So the correct answer here is B, all of them. In apoptosis, cytochrome C acts through A. APF1, B. BCL2, C. FAD, FADD, and D. TNF alpha. So the correct answer here is APF1, which is activated for nuclear fragmentation in apoptosis. A. Caspases, B. APAF1, C. Oxygen free radicals, D. All. These caspases. Caspases and endonucleases cause chromatin fragmentation in apoptosis. They are inactive, so first they should be activated. Cytochrome C binds with APAF1 and this complex activates caspases. Caspases cause fragmentation of chromatin and also activate endonuclease. So the correct answer here is A, caspases. Annexin B is a marker of A, apoptosis, B, necrosis, C, atherosclerosis, D, inflammation. It is apoptosis. Annexin VSS provide a simple and effective method to detect apoptosis at very early stage. This assay makes the advantage of the fact that phosphatidyl serine is translocated from inner cytoplasmic leaflet of plasma membrane to outer leaflet soon after the induction of apoptosis, and the annexin V protein has strong specific affinity for phosphatidyl serine. Phosphatidyl serine on the outer leaflet is available to bind label annexin V. So it is apoptosis. Which of the following marker is specific for gastrointestinal stromal tumor? A CD117, B CD34, C CD23, D S100. The following markers are present in GIST: CD117 95%, CD34 70%, smooth muscle actin 5%. CD117 c-kit is considered the most specific marker. Immunoreactivity is best defining feature of GIST, that is gastrointestinal stromal tumor, distinguishing them from two smooth muscle tumors. Multiple epidermoid cysts are seen in A. Burkhardt syndrome, B. Gardner syndrome, C. Peter-Jeghers syndrome, D. Familial polyposis coli. It is seen in Gardner syndrome. Gardner syndrome include edematous polyps of gastrointestinal tract, desmoid tumor, osteoma, lipomas, dental abnormalities, periampullary carcinoma. The features of Crohn's disease are all except lymphoid hyperplasia. Please click the link in the description box to join the ultimate Minute PG Breakthrough Blueprint event. Female is affected, male is not. Disease is autosomal dominant. What is the chance children affected? It is 50%. The correct answer here is A, 50%. The inheritance pattern of familial retinoblastoma is A. Autosomal recessive, B. Autosomal dominant, C. X-linked dominant, D. X-linked recessive. It is autosomal dominant. Male to male transmission is seen in A. Autosomal dominant disease, B. Autosomal recessive disease, X-linked dominant mitochondrial disease. It is seen in autosomal dominant disease, which is not a feature of Down syndrome. The pigmented birthmarks is not a feature of Down syndrome. So correct answer is B. Lines of John occur in A. Postmortem plot, B. Infarct, C. Embolus, D. Coralline thrombus. It is seen in coralline thrombus. Anemia with reticulocytosis is seen in A. Hemolysis, B. Iron deficiency anemia, C. Vitamin B12 deficiency, D. Aplastic anemia. It is hemolysis. Conditions which can cause reticulocytosis are acute blood loss or hemorrhage. Post-splenectomy can cause reticulocytosis. Microangiopathic anemia, autoimmune hemolytic anemia can cause reticulocytosis. Hemoglobinopathy, that is sickle cell anemia, thalassemia can cause reticulocytosis. Post-anemia treatment like folate supplementation, iron supplementation, vitamin B12 supplementation can cause hemolysis, reticulocytosis. Maximum spirochetes are seen in A. Autoimmune hemolytic anemia, B. Vitamin B12 deficiency, C. Aplastic anemia. Maximum spirochetes are seen in A. Autoimmune hemolytic anemia. The anemia associated with leukemia is A. Iron deficiency, B. Megaloblastic type, C. Myelocytic type, D. All of the above. So the correct answer here is C. Myelocytic type. Chemotaxis is mediated by A. Histamine, leukotriene B4 and C4, C5A, leukotriene C4 and C3A, bradykinin. It is leukotriene B4 and C5A. Hyperimmune IgE syndrome is also called A. Job syndrome, B. Wiskott-Aldrich syndrome, C. Chidiac-Higashi syndrome, D. Jaeger syndrome. It is Job syndrome.